Hi, my name is Ashlyn Lottering and I'm one of the perfusionists for JJ&J. Today we're going to have a small chat on afterload, preload and contractility. Reload. So I want you to imagine going. Now as you're holding your breath, just before that's what we can imagine when we think of preload. So your preload is the stretching of the myocardium muscle. It's the actual pressure that the blood places on the muscle fibers of the ventricle. So it's just before the muscle is about to contract. It's the amount of volume within the ventricle. On the note of preload as well, it's also known as your left ventricular end-diastolic pressure. So your LVEDP. The preload we discussed it. Now we're going to discuss the which is also known as your afterload. So your afterload is the amount of resistance that the heart actually has to overcome in order to open the aortic valve and allow the contents of the left ventricle to be emptied into your systemic circulation. Afterload is how hard this ventricle has to squeeze in order to overcome the pressures outside the aortic valve so that the aortic valve can open and empty its contents. This is also known as your systemic vascular resistance. Stretched, we've pushed, we've overcome. We're going to look at cardiac output. And your cardiac output is the volume of blood that the heart pumps per minute. A simple calculation of your cardiac output is your cardiac output, which is your stroke volume times your heart rate. And lastly, contractility, which is the ability of the heart muscle to contract and pump blood. So we've successfully. Thank you. Thanks for not scrolling. Hopefully you learned something new today and had fun while doing it. Take care, and until next time, I'm Ashlyn.